Michelle Scola, a nurse practitioner with the Neshoba Valley Board of Health, and I'm here to bring you your summer health update. And today we'll be overviewing some health and safety tips. So today we're going to have a nursing guide to our summer safety and keeping your family safe for the summertime. So some pertinent topics we'll review today are sun safety, we'll talk about a quick skin assessment, we'll talk about water safety, and then we'll end with summer rashes and allergic reactions. So to begin, we're just going to start off with some facts for our sun safety, and these are basic facts. So rates of skin cancer are 1 in 5 Americans, and they're growing drastically. And this is because, we have a lot of UV rays, UVA, UVB, that we may not be protecting ourselves against efficiently. So the American Academy of Dermatologists suggests that we wear a water-resistant broad spectrum, which means that it covers UVA and UVB rays at an SPF of 30 or higher. So if you're getting a 15, it's really not giving you the right protection. So we want to go with 30 or above. And as long as you're putting it on, you're not fully protected. You want to make sure that you're reapplying and that you are making sure that when you are drying off with your towel after you're in the pool or at the beach, you just give yourself a little pat off to dry, so that way you're not removing everything. Also being cognizant of sweating. If you sweat off your sunscreen, that is when you would want to reapply as well. So along with your basic SPF, we do also have our zinc-based products that we recommend using on areas that are very sun sensitive, and that's on the face. So the nose, the back, the tips of the back of the ear, right on the cheeks, and that is where the sun tends to hit more frequently. The difference between a regular UVA, UVB sunscreen versus a zinc sunscreen is that it actually provides a physical barrier. So if you see this picture, you see this cute little baby and a little bit of a white cast on their face, and that's because that zinc-based type of sunblock does not absorb fully into the skin. So you'll always see a little bit of residue there, and that's totally normal. They actually do sell it in different colors now. So if you wanted to, have your kiddo pick out a different color, pink, purple, blue, they have them available in a little stick form. So they'll be able to paint their own face, and it's kind of fun that way as opposed to just having, white residue on the face. Along with our reapplication of our SPF every 2 hours and after swimming and sweating, we also want to look into protective gear. So we want to make sure that we're wearing cool, comfortable clothing. We want to make sure that we have sunglasses on because that's going to protect your eyes. And we also want to wear some sun barrier clothing, especially if you have any history of sunburning or skin cancers or pre-skin cancers. They do sell clothing that has sun protection in it, and that will make it a lot safer in the sun along with your sunscreen. Another safety tip is to try to avoid direct sunlight during peak hours. So that's between 10 a.m. and 4 p.m. And if you think about that, that's obviously when the sun is right up at the center of the sky. That's when we're getting all of that direct sunlight. So if we're able to find shade or stay inside in our comfortable air conditioning during a good portion of that time, you'll be able to protect yourself from the sun a little bit more. And just some pro tips, 80% of UV rays can go through clouds. So if you have a hazy day, that tends to be when a lot of people end up getting more burnt. Then that's because you don't feel hot, you don't feel that direct sun that is beating down on your skin. So, if you're comfortable, there's a nice breeze, and it's a little bit shady, you still are at a risk for sunburn. So make sure that you apply your sunscreen and reapply your sunscreen on those days. And even in off-season, our UV rays actually bounce. They can reflect off of water, snow. So in the winter, when you're driving on the street and you get that big glare from a snow pile that's on the side, that is UV rays reflecting off of there. So you still want to make sure that you're wearing sunscreen, especially on your face, because that UV ray will reflect right off of those. So just some special considerations. We always want to look out for our vulnerable populations, and one of those is kids. So our newborns, our children, and our infants. So infants 6 months and under should not wear sunscreen because their skin is very thin. We have a lot of absorption through the skin, so we would be exposing them more to toxins. So we avoid sunscreen and the chemicals that are in it, and we just try to cover their skin as much as we possibly can. So we want them in the shade, we want these special umbrella hats, make sure our UVF clothing, and we want to make sure we're covering the face and ears. So we have some nice clothing on here. Pictures from Amazon, so you can buy them whenever you want. We have our UV blocking bathing suit. We have this nice hat that I really like because it gives you a 3-inch brim along with protection around the ears and the back of the neck, which is a big deal because that's where sun usually hits. And then when you are looking at children and older infants, our toddlers that are over 6 months of age, those are the people that we really want to make sure we have reapplying, because they're the ones that are going swimming, they're running in and out of the ocean, they're jumping in and out of the pool, so their sunscreen is going to come off a little bit quicker. So those are great candidates for that colorful zinc type of sunscreen that we can use, and just making sure that maybe they're wearing a hat or a rash guard bathing suit instead of not having anything on the skin, just to protect them a little bit more. Our next population we'll look at is our older adult population. So older adults are at a higher risk for skin damage. This is because they have a lot of chronic conditions, they've been having age-related changes for their skin, and they already have damage because they've been in the sun for so long. We're living for longer, so now we have more time basically for our skin to be exposed to the sun. So I have a picture here that actually shows prolonged left-sided UV exposure, and this is a man who was a truck driver. So he wasn't wearing sunscreen on his face, and we can see that over 20 years of driving with the sun beating down on the left side of his face has caused this aging, as opposed to the other side that looks like a little less wrinkly, a little less saggy. Statistically, older adults are actually more likely to use less sun protection. They're not as worried about putting on their sunscreen. So we want to make sure that if we have any older adults in our life, our grandparents, our friends, family, we want to make sure that they're wearing their sunscreen, because we want to make sure that, that high risk category that they're in, we want to make sure that they're protected. And if we're looking at statistics, we see that melanoma cases rise exponentially with age. So if we look at our next visual here, we actually see the rates of melanoma in the United States for specific age groups. So, we see our younger population, not a really high rate, and then we see as we're getting up past age 60, up to 85 and over, we are having this really large growth of this population. So the best thing to do, one, is prevention. So start putting sunscreen and sun protection with your children so that when we get to this older age, we are having less rates of melanoma. So prevention is key, because it's easier to prevent than treat in any occasion. But that doesn't mean that older adults, it's not too late to start wearing your sunscreen. So we'll look at skin screenings now. So looking at your skin for yourself, we really want to make sure that you have awareness of your skin. You don't need to be doing a monthly check of your skin, but you want to be aware of what your skin looks like. You want to know, what kind of moles, what kind of coloration that you have on your skin, mostly because we want to make sure that you know if something changes. So if you are aware that you have a family history of skin cancer, either melanoma, basal cell, squamous cell are the most common types to get. If you have family history or if you have personal history, and you want to make sure that you are kind of having this awareness of your skin. And the easiest rule to go by is the ABCDE rule, which looks for asymmetry, borders, color, diameter, and evolving. So this means that a mole or any sort of skin marking should be symmetrical. It shouldn't look different on one side versus the other. It should have a regular border, meaning it shouldn't look fuzzy on the outside. The color should be uniform throughout, so it shouldn't look dark in one spot and light in another. The diameter should be less than a pencil eraser. So we usually say a couple millimeters, but pencil eraser is kind of easier because not a lot of people can just think to their ruler what that looks like. And then finally, evolving. If you had something that looked one way and then it changed, you want to have it checked. So when in doubt, just make sure that you're going to see your provider if you see something changing or something that looks abnormal. And we have a couple of visuals here where we look at our normal moles versus our abnormal moles. So we see this asymmetry on these first, this marking on A is very round, while this one has some jagged borders. And then again, the borders here, we have a picture of a melanoma, and that has those irregular borders versus even borders. We see multiple colors in our abnormals, and also we see large diameter as opposed to being less than a 1/4 inch. And then finally, we see evolving changes, meaning that, you had a mole last year you noticed it looked normal, and then all of a sudden it looks a little bit bigger than it did before, or the outside just looks a little bit fuzzy. It kind of looks like you took an eraser to it, and it looks a little bit shaded. So those are the things that you really want to keep an eye out for. I always tell my patients that going to get an annual screening for your skin isn't going to hurt anything. And if it's covered by your insurance, it helps keep track of everything, and you have a professional looking things over. But always, like I said, that skin awareness is going to be really important. Now we'll move on to our water safety section. In the summer, it's really important to be cognizant of drowning rates. Especially in children, drowning is the leading cause of death in children, especially 1 to 4 years old, other than congenital defects. So it's a type of death that we can obviously prevent. So we want to make sure that we're aware of the risks. Something that's really important to remember is that drowning is silent. You're not going to hear splashing. You're not going to be able to hear a child if they can speak. Oftentimes you can't hear them calling for help. And if they're under the water, you're not going to hear that water movement. It can happen in seconds. So, you might be looking and you look away. Kid's already under the water by the time you look back. So there are some rules that we usually give for being near the pool. One thing is that you have one adult who is within an arm's reach of the people who are swimming. That way, if something happens, they can quickly react. And then other than that, you have adult watchers, meaning that you always have someone who has eyes on the pool at all times. Swimming lessons are great once you feel like your child is ready, but even now can have kiddos who are infants in swimming lessons, just to get used to the water, not being afraid of the water, learning the right positioning, and that way, they're a little bit more comfortable when it comes to swimming. If you have a child in swim lessons, that does not guarantee they will not drown or have an accident in the water. So it's going to keep them safer, but it's not a guarantee that there is complete safety. I also recommend learning CPR. Anybody can save a life if they know CPR. And even though we have this lead cause of drowning, 1 in 5, drowning accidents will lead to death. The other 4 may lead to injury. So having that CPR knowledge and knowing when to react is something that is really important, and it's going to help a lot of people. Another thing we want to remember is our children who are less than 1 year old are also at a risk for drowning, but not as high risk as at the pool because they can't walk around that area most of the time. They are at a high risk for drowning in the home. Bathtubs, if we have coolers out, if we have kiddie pools. Infants can actually drown in as little as a few inches of water. So making sure that we keep our drains open. You always have someone watching a kiddo in the bathtub. If you have a cooler and ice is melted, store all your buckets and your coolers upside down, just to be safe. For our adolescents or teenagers who are swimming out, they actually have a higher rate of drowning in bodies of water. So not just your pool, but actually the ocean and lakes. And that can be one because adolescents tend to be riskier, right? They're young and they're having fun, so they're maybe not paying as much attention, but also there's these hazards that we may not be aware of. So we have, ponds with seaweed or weeds that we may not see, and they could, drag onto the skin. We want to be making sure that we're aware of the water and the currents because we have those riptides that people can, swim and get caught in. And remember, always coach that if someone is caught in a riptide, you want to make sure that you swim, let it drag you, but swim to the side because eventually you're going to be able to get out of the riptide. If you are in it and you try to swim against it, you'll tire out, and that will lead to an increased risk of drowning. So it's great to know where are the high-risk areas. That way you can just be cognizant of what could happen. Another thing is to know your limits. So if something water is too cold, if you're too tired, if you got too much sun, don't do anything so super risky. Stay in the shallow end of the pool. Maybe just dunk your feet. Don't go in the ocean where there's a pretty significant riptide because you might not have the energy to swim and you'll be at a higher risk of drowning. So the next slide is just some safety tips that we have. Some quick prevention that we can look at for kids with pools and also in home. So again, staying in arm's reach, but you always have that constant supervision. Child-proofing your pools. So home pools, you're gonna have that fenced-in area. Sometimes they'll recommend putting alarms on the doors. You wanna make sure that there's a lock that children cannot get into. Using any sort of flotation device. So in the pool, we have those puddle jumpers now that a lot of kids wear that will have the flotation device on the chest and on the arms. Life jackets for if kiddos are in the water, and adults should be wearing life jackets if you're on a boat as well. You want to make sure they fit well, because if you have a child who is a little bit too small and that swimmer is big, it will actually cause them to be dragged over and they'll get face first in the water. And if you're next to them, it's okay, you can pick them right back up, but it's a little uncomfortable. And then finally, our swim lessons and our CPR certification. Now for our homes, we want to make sure that we are closing our washing machines. If we have any hot tubs or in-home spas, we want to make sure that we cover them if they're not in use. We want to remember this for pets as well, because it's pretty easy for your pets to crawl into your washing machine and into your laundry. Make sure that we're always emptying anything that could be filled with water. So sinks, pails, coolers, containers, anything. And then always, of course, supervising, especially when kids are in the bathroom. The next big piece is hot tub safety. So we all love a hot tub, right? There are safety risks in hot tubs and also illness-related risks. So there are a lot of germs that can spread through hot tubs that can cause respiratory issues, skin issues, or gastrointestinal distress. And there are certain risk factors that we should be aware of if we're going to be using hot tubs. One is swallowing water. That's going to be a direct entry for germs into your body. So we're going to try to not do that if you can. That will probably be something that if children are in a hot tub, then they're going to have a higher risk of swallowing. We also want to make sure that if we are in the hot tub for too long, we should be aware that we're having this increased contact with mists or aerosols that are being kind of put up into the air from the rotation and the jets of the water. Those can be contaminated with germs. So if you've ever heard of Legionella and Legionnaire's disease, that is usually something people get from a hot tub, a body of water, or even soil that they'll end up being aerosolized and kind of breathed in. And that can cause pretty significant pneumonia that would is an emergency medical situation. You definitely need to be on antibiotics for that. Something else to remember is that they really only recommend 15 to 45 minutes in the hot tub. It can lead to overheating, you can get dehydrated. You can also get a pretty significant skin rash if there's bacteria in there. It's called, they can call it hot tub rash or hot tub folliculitis, and it's a Pseudomonas infection. It's a type of bacteria that will get into your hair follicle. So another thing I would recommend is don't shave your legs or anything directly before you get into a body of water, especially a hot tub. Not only will it burn, but you could end up, you're just opening the skin for a bacteria there. Best thing to protect yourself, because I definitely, you don't want to not have fun during the summer. You want to be able to use the hot tub and use a pool. So we want to make sure that you're being as safe as possible. So the first thing I would recommend doing is to bathe before entering. So any pool or any hot tub, in that way, you're preventing germs from being brought into there. Don't swallow the water. I would recommend no children under 5 in a hot tub, only because you can't really regulate the amount of germs that are going in there. The drains are actually more, they're closer to where you can kind of get stuck in a hot tub as opposed to a pool. So there's more likely that a child will be able to step on a drain or get their hair caught in a filter, and that's a high risk for drowning. Don't drink alcohol if you're going to be in a hot tub. I know that is easier said than done in most cases, but alcohol will lead to dehydration, overheating, and of course just a general lack, a reduction in awareness for safety. ACOG, which is the American Council of Geriatrics, they recommend that in pregnancy you do not use a hot tub. And that is because we do not want the body temperature to raise above 102 degrees in pregnancy. And most hot tubs are set to 104 degrees. So we don't want to cause any distress or damage to the fetus. So we don't want pregnant women in hot tubs, and we also recommend the same thing for baths. You don't want really, really hot water in your bath. After you're done in the hot tub, make sure that you wash your bathing suit. Make sure you're using soap to get any of those germs out of there, and also take a shower right away. Sometimes if I'm in a hot tub or a pool, I'll just hop in the shower with my bathing suit on and get everything kind of washed off first. Make sure you're using warm water and soap on your body to get all those germs, and then throw your bathing suit right in the washing machine with some water. The final thing that you can do is if you are pool savvy and you know how to check chlorine or bromine levels and pH levels, if it's your hot tub, you want to make sure they're in a specific range. Normally that's 3 to 10 for chlorine or 7 to 7.8 for your pH. I don't know that off the top of my head. I have it written down. But if that's something that you have a hot tub at your house or a pool at your house, you want to make sure that everything's in the right level so that anything that is a foreign germ or microbe is being treated as best as possible. And just, this is the picture I was talking about. You can see that follicular bacterial infection. So on the left, you see that this is both the same Pseudomonas folliculitis, or that hot tub rash. The top looks a little bit worse. We have those kind of pustules there. They're likely filled with pus, and it's widespread. The bottom is still the same thing. Those individual hair follicles are showing you that they've gotten that bacteria in them. Usually that would require antibiotics, oral antibiotics, if it's that widespread. So you're definitely taking a trip to the doctor. If it's mild, there are some antibiotic creams, but it's usually indicated for small areas. And you're more, if you're in a hot tub, your whole body is basically being covered in that water, right? So you're probably gonna need to be treated with antibiotics. The second picture is actually a diseased lung with Legionnaire's disease. So we see that pneumonia on the bottom right. And even if you didn't have the picture on the top, you can see that that lung is clouded. So we have that white out on that side. And if you look above, that's a picture of a normal chest x-ray. So we can see that infection that is sitting in that lung. And that is from breathing in those particles from the hot tub or from soil that can aerosolize, and you can breathe them right into the lungs. So that is something that we're at risk for. It is not super common, but it's going to be higher risk if you stay in the hot tub for too long, or if it's not treated appropriately with the right chemicals to kill bacteria. Moving on to other rashes, and there are a whole lot of them for the summer. Skin is a fickle thing. We have a lot of rashes for a lot of different reasons. I just go over a few of them here. One that's really common is our heat rash. It also can be called miliaria, and it comes from blocked sweat glands. So if we wear light clothes, loose-fitting clothing, and we make sure that we keep cool and we take cool showers, we're likely to have less of a chance to get heat rash. And if we do that, if we get heat rash, it's likely it'll go away faster. We have contact dermatitis, which a lot of the times you'll see from our plants during the summer, poison ivy, poison oak. So the best thing you can do with that is to, one, know what the plants look like, especially if you garden or if you mow the lawn, because we know that those rashes we get from poison ivy come from the oils. So if you mow the lawn and you weed whack a bunch of poison ivy, all those oils are gonna aerosolize and probably get on your skin as well as being breathed in. So making sure that you are covering your skin. So if you are gardening, wear your gloves, wear your long sleeves, tuck your pants into your socks. I know it's hot, but you can wear those cooling, moisture-wicking types of clothes to keep your skin protected. And just remember that once you have a reaction to poison ivy, poison oak, any of these types of plants, it will get worse every single time. That's the way your body reacts. That is, just the immune system. So if you've gotten poison ivy once and it was really minor, if you get it again, it will likely escalate. So there are some people who get a little rash, and some people will just break out, whole significant rash right over the body. And treatment is, based off of how severe it is. Insect bites, super common during the summer, and there are a bunch of them. We have our common mosquito bites, we have black flies, bees. Spiders aren't as common in Massachusetts, but they can happen. If a spider bites you, it can be severe, but the odds of it happening in Massachusetts are way less. So you can be cognizant it can happen, but it likely won't happen. If there's a stinger, make sure you're removing it. Otherwise, clean soap and water, you can put some ice right on it, and you can use over-the-counter cortisone cream on any bite. Of course, we want to make sure that if there's any allergic reaction, we should be aware of it. Benadryl or other types of antihistamines are really helpful if we have any swelling. An allergic or bite reaction is it's a histamine reaction. So if we take an antihistamine, it will likely help it. If you're giving Benadryl to a kiddo, especially if they're younger, just make sure they're in the right age range. Something that can happen with really young kids if we give them antihistamine like Benadryl is that most of the time people will get drowsy from Benadryl, but in children it can actually have the opposite reaction and they can get super energetic. So you might not want to give it right before bedtime for the first time. You want to wait a little bit, but wait. Ask a PCP if it's the first time that you've ever given a kiddo Benadryl, just to make sure their age and weight is appropriate. Other than antihistamines, when you should contact your PCP is if it's the first pediatric basting, if there's any type of swelling, especially if there's any type of evidence of anaphylaxis, if there's any difficulty breathing, that would be something that you'd want to go to the emergency room for. If we have any evidence of erythema migrans, which is basically Lyme disease from a tick bite, and most of the time people think of that as that bullseye rash, that is really common. That's what we know Lyme for. Other skin reactions, we have eczema. It can flare in the winter, but also flare in the summer. So people who have eczema, they usually know when their flares are going to be, but some people are just diagnosed. So it can be exacerbated by heat. It can be exacerbated by swimming. Usually bromine is a little bit better than chlorine for people with eczema, but any of those things can cause flares. Something else we should be aware of is acne. Acne will worsen in the summer, so that might affect our teenage population or anybody who is very prone. And that's usually because we have extra heat. We get sweatier, and that is a breeding ground for bacteria. So dry skin, super common in the summer. Again, the extra sunlight, the pool, so making sure that we are removing any extra chemicals off the skin and moisturizing. Also taking showers or baths using tepid water instead of really hot water will help you to not get super dry skin. Another thing we can be aware of is a paronychia. A lot of people are getting pedicures in the summer, getting their nails done, because everyone's going to see your feet. So just be aware that there can be bacteria that get into the nail bed. So when you're at a salon, make sure that you're only pushing back the cuticle when they're moistened or soaked. You don't want to be pushing and forcing back your cuticle, and you don't want to be cutting your cuticles at all. And just making sure everything's clean that they're using. Sunburns, we've kind of talked about that already, but just to be aware that any color on the skin is considered damaged. So if you get a nice tan, it looks great, but that also means that your skin is damaged a little bit from that. And then finally, we have this exercise-induced vasculitis that kind of looks like a rash, but it's actually vessel damage. They call it Disney rash or golfer's rash. So what happens with this is that when it's really hot, your blood vessels will dilate, and if you're standing and walking for a long period of time, that can actually damage the blood vessels. And if you're walking and it's hot, that's the perfect storm for these vessels to be kind of dilated and damaged. It will go away on its own, but the best thing you can kind of do is elevate your legs, making sure that you're not in the hot weather. And if you know that you're going to be golfing or going somewhere where you're walking a lot, try to start walking little by little in the heat before you go, so that your vessels can kind of get used to it. An interesting thing with the Disney rash or the golfer's rash is that it will have a line right where your sock is and start above it, because the sock gives compression. And compression helps that vessel kind of pump blood up and down. It improves your circulation. So you see this kind of rash, but really that vasculitis occur right above the sock line. So that's how you know it's that, as opposed to a regular skin rash. So those are the most common things that you may see during the summer. And of course, we just want to be prepared and make sure that we're preventing all of these conditions, and still trying to have as much fun as possible and enjoy the season before we start fall and winter all over again. Thank you for watching this presentation. I'm Michelle Scola with the Board of Health in Lunenburg. I hope you enjoy your summer.